When a former US president is diagnosed with metastatic prostate cancer, the world pays attention. But what does this diagnosis really mean? And what can it teach us about our own health? In today's video, we're going to unpack President Biden's diagnosis and what every man, especially those men as they progress through life, needs to know. Hi, my name is Dr. Charles Chabert. I'm a urologist and director of the prostate clinic located on the Gold Coast in Australia. Please, as always, if you get value from this video, consider subscribing, give the video a thumbs up, switch on your notifications, and leave a comment, a question in the section down below. Okay, let's get into it. About prostate cancer, its symptoms, its treatment, and how it spreads, and how we might be able to catch it before it actually does spread. We're going to dive into prostate cancer, its symptoms, its treatment, and how to catch it before it spreads. Prostate cancer starts inside the prostate, and the prostate is a small gland. It's traditionally described as the size of a walnut, and it sits at the base of the bladder. It's sandwiched, if you like, between the base of the bladder and the pelvic floor and shaped a little bit like a donut. Its role physiologically is to provide supporting fluid for sperm to try and improve the chances of conception. As we get older, there are a couple of conditions that affect the prostate, including enlargement and also the development of an abnormal growth or prostate cancer. Prostate cancer is actually one of the most common forms of cancer that are diagnosed in men. For the majority, it can be slow growing and very treatable, particularly if it is caught at an early stage. But in some cases, like President Biden's, the cancer can become aggressive. And when it spreads beyond the prostate, we call that disease metastatic. And so metastatic prostate cancer is disease that has left the prostate and spread to other areas of the body. And this is where it can become a lot more serious, and it can be far more challenging to actually treat. With prostate cancer, the two most common areas of spread include the lymph nodes inside the pelvis and further afield in bones. And certainly from reports that we've had over the last week, President Biden has had prostate cancer that has spread to his bones. In fact, on May the 16th of this year, 2025, it was confirmed that President Biden did, in actual fact, have metastatic prostate cancer. The report said it had spread widely, and this is consistent, as I've said, with the most common distribution of spread of prostate cancer that we see. Moreover, his doctors described his disease as hormone sensitive. Now, the wording of this is quite interesting because, in essence, all prostate cancers are hormone sensitive at the start of their evolution. What that means is that prostate cancer is responsive to our ability to manipulate testosterone levels. When testosterone levels are normal or elevated, this can, if you like, provide a fuel to the fire of prostate cancer. One of the ways we can treat prostate cancer, metastatic prostate cancer, is by giving men drugs that reduce the production of testosterone and reduce the effectiveness of any testosterone that could be produced. In the early phase of prostate cancer, we call this castrate sensitive, when the disease responds to our ability to manipulate testosterone levels. With time, after being on drugs for many years, usually many men can develop castrate resistance, which in essence refers to the situation that we keep testosterone levels low, yet there can still be disease progression. And so it was reported that Dr. Biden did have hormone-sensitive disease. Now, whilst this is an advantage because it means that his disease is amenable to treatment, this situation really highlights the need for awareness and the need for action so that other men may learn from this situation and try and identify if men have prostate cancer that is localized to the prostate before it actually disseminates and spreads elsewhere. Once prostate cancer spreads beyond the prostate, as indicated, it goes to lymph nodes or to bones, and those bones preferentially can be in the spine, the pelvis, or actually in the ribs. Sometimes men actually present with symptoms from these deposits and symptoms related to metastatic disease, such as bone pain, weight loss, fatigue, no energy. And when we have this, in essence, the disease is far harder for us to treat than if we're dealing with organ-confined disease. But here's the challenge. When prostate cancer is confined to the prostate, it can actually be very hard to detect because it can be completely asymptomatic. I have previously done a video looking at the 10 warning signs of prostate cancer, which in some way described urinary symptoms related to bladder outlet obstruction from compression of the urethra or the outlet pipe of the bladder. As you may be aware, prostate cancer, when it does occur, it tends to arise in the shell of the prostate, so away from the outlet pipe. And when this happens, men actually can have very few urinary symptoms. And so the way that we diagnose prostate cancer is dependent upon the PSA test initially. Now, it's important for men to have regular checkups because one PSA, although if that PSA is performed at a young age, where there is less likely to be the confounder of BPH or the benign enlargement to the prostate, which can push the PSA up. It is the trend of PSA across time, which can give us some clues as to the behavior of what we think might be going on inside someone's prostate. Okay, let's talk about PSA testing. Well, PSA stands for prostatic specific antigen. It's a blood test, and the PSA is produced exclusively by the prostate, and in certain conditions, including prostate cancer, enlargement, or inflammation of the prostate, there can be an elevation in the PSA test itself. Having the blood test, discussing your risk of prostate cancer with your local doctor, having an examination, and potentially having an MRI scan, depending on the results of these tests, really is crucial for detecting asymptomatic early prostate cancer, where it is far more likely to be successfully treated with the potential for cure. Now, some advocate not performing a PSA test in men over the age of 70. But President Biden's diagnosis really reminds us of the importance of continued surveillance so that you understand your risks and can make an informed decision with regards where your prostate cancer risk lies and what you would like to do from a management point of view moving forward. It's interesting, since President Biden's diagnosis, I understand that some cities such as New York have now offered or launched free prostate cancer screenings. So really, this should be used as a wake-up call for many men as we progress through life, particularly if you have a family history of prostate cancer, if there is a strong family history of breast cancer in your family, or if you're of African American descent. You are at a higher risk of a lifetime risk of prostate cancer than others. So although President Biden's diagnosis comes as a bit of a shock, particularly when he, one would assume, had access to some of the best medical care globally, that he should be diagnosed with a metastatic cancer certainly is a surprise, and it does raise the possibility or the potential question that he may have actually had a prostate cancer diagnosis that preceded this particular announcement. Whatever the case may be, if we use this as an opportunity to educate men so that we are aware of the risk of what can happen to the prostate when we progress through life, and if someone is going to develop prostate cancer, we detect it at a far earlier and treatable stage, then hopefully this cloud has a silver lining. So President Biden's story really is a powerful reminder that we do need to take care of ourselves, eat well, exercise well, perform resistive exercises, limit your alcohol consumption, don't smoke. These are things in addition to regular checkups with your local healthcare provider that can facilitate early detection of a variety of conditions that can keep us healthier for longer. Please, if you got benefit from the video, consider subscribing, give the video a thumbs up, hit the notification button, and as always, please take care of your prostate.